to best care for an epileptic. December 4th, 2008 changed my life forever. That was the morning I discovered my son having a grand mal seizure after only one dose of Vyvanse that was supposed to help manage his ADHD. Knowing what to do during an epileptic episode can help you save a life or prevent permanent damage, as I did. Now today I will share with you the known causes of epilepsy, the correct method of aid to offer someone having an epileptic episode, as well as any treatment options available to the epileptic patient. Now I am an Air Force trained medic who is also the parent of an epileptic. After my son's episode, I spent countless hours learning about his disorder and the proper way to care for him. Today, I will reveal the known causes of epilepsy, as well as the proper first aid to offer someone during an episode, and any treatment options available. Now, in order to properly introduce you to this disorder, I must first shed some light on the causes behind it. Now, according to WebMD's Epilepsy Guide published in 2009, in 70% of all known epilepsy cases, no cause has ever been discovered. But Harvard Health Newsletter published in 2006 stated that other causes have included head injuries, genetic conditions, tumors, strokes, and infections. Now, there was a study done in South Africa in 2007 where they polled 12 parents of epileptic children, and some of their responses were a little different. Some parents stated that they figured their child's episodes were triggered by emotional distress or fear. But there were a few parents that stated they felt their child's episodes were triggered by evil spirits or some type of bewitchment. To each his own. But the best thing to do, there are some things they can do on their own to prevent seizures, and that's to avoid common triggers, such as missing a dose, not getting enough sleep, or taking your seizure medicine too close to any other medicines you may already be taking. Now, in 1 out of every 2 women with epilepsy, their menstrual cycle has been known to trigger seizures. So that's some PMS for you. Other things to avoid are alcohol and illicit drug use, again, according to WebMD's Epilepsy Guide. Now, with a better understanding of the causes, we can now address the correct first aid measures needed if you witness someone having an episode. Now, some basic first aid and basic tips about epilepsy. First of all, epilepsy by definition is the tendency to have seizures. Seizures themselves are a symptom of epilepsy, not epilepsy itself. And one of the things that they can do to help themselves is carry some form of ID, be it a bracelet, necklace, or a wallet ID card, something that can identify their condition. And their symptoms will be based on the type of seizure that they have. They should also avoid high places. They should not bathe in a tub. They should not be left alone. They should not stop their therapy without their doctor's permission. And whatever you do, do not hold them down, and don't put anything in their mouth while they're having a seizure if you plan on getting it back. And don't leave them laying on their back. They should be turned on their side. There are 2 main types of epilepsy, generalized and partial. A generalized epilepsy is characterized by loss of consciousness along with full body movement, known as the grand mal seizure, like my son had, or the petit mal seizure, which is altered consciousness but no abnormal movement. And with the partial epilepsy, you have abnormal electric activity, and it only involves one area of the brain, and this defined as either simple or complex. Now, with more than 30 types of epilepsy-related seizures, accurate diagnosis is critical before any treatment can begin. And the way they do that is through diagnostic testing, such as the EEG, the electroencephalogram, which records brain signals like a polygraph used to identify the specific type, based on Professor Guarini's seminar published in 2006. He also recommended an MRI, which is magnetic resonance imaging, and that takes detailed pictures of the brain using high-powered magnets, and it is used to track changes in the brain over a long period of time. Now, WebMD also states that the medications given to the epileptic patient are patient-specific, based on their age, weight, and any other underlying conditions, and it helps the doctors figure out the desired effects they would like to their patients to exhibit. And they should be taken as directed, closely monitored over several months, and it will often include lab work. Let's review, shall we? We learned that although there are several factors that can trigger a seizure, most epilepsy cases have no known cause. Appropriate first aid can ensure survival, and the type of epilepsy is determined by the treatment plan. My crash course has transformed me into a subject matter expert on the many facets of epilepsy. By keeping to his recommended dosing schedule along with regular checkups, my son has been episode-free for more than a year. With the right care and proper treatment plan, epilepsy can be prevented from becoming terminal, as was the case for John Travolta's son Jet, who died at the tender age of 16 on January 2nd, 2009. He was left alone in the bathtub while his parents were on vacation and drowned after having a seizure. His death is a perfect example of what not to do for a known epileptic and could have been avoided with the proper care. I am Tech Sergeant Makita Evans, and I approve this message.